As Ghana attempts to vaccinate some 20 million of its population, but people with disability have seemed to be forgotten when it comes to who takes the vaccine first. Now in studio with me is the Executive Secretary of the Mental Health Society of Ghana, Humphrey Coffie. Now, grateful for your time and happy Easter to you. You've raised certain concerns about the priority list. Now, is the society okay with this?
Very well. So one thing the Mental Health Alliance has recognized after reviewing the priority list is that persons with disability, including mental health, appear to have been forgotten. These are people who have underlying conditions, and they constitute a critical mass of people that if a country is supposed to generate a priority list for those who have been vaccinated, we cannot understand and appreciate how government could take these people off. The judiciary, the executive, and the parliament are part of this essential list. Fine, because people may also have underlying conditions. But these critical mass of people cannot be forgotten in the priority list. We've taken delivery of 600,000 vaccines, 50,000, we are expecting 300,000. All these people who are supposed to benefit, you will not have the list of persons with disability. And that is impossible. As a growing state that should be responsible to persons who are vulnerable, we cannot develop a list without these critical mass of people. And it is also so because government has not involved them even in the design of COVID-19 responses, including economic, social. So it's not so surprising that they are not part of the priority list. And we are saying that government should review the list as soon as possible, include all these people with mental health conditions as other conditions like autoimmune deficiency, etc. These are people who have underlying conditions, and they need to be responded to first, even before others.
All right, now, you also raised certain concerns with regards to the budget, that there's a lack of investment towards mental health. So really, do you think that the mental health in Ghana here is actually resourced well?
Very well. So what it is that as we review the 2020 budget, we realized that about 1.4% of the total health budget was allocated to mental health. That is fairly inadequate. Currently, about 85 to 98 people who require mental health services are not having access to mental health services. That aside, you also realize that less than $1 is spent on people with mental health conditions. So the Mental Health Authority, together with its alliance, are saying that the new investment case should look at reviewing the less than 1% dollar that is given to a person for a year to $3 to $4. That will take it to about 540 Ghana cedis per year. And that will take us to about 720 million Ghana cedis. That is what we want to see. And that is how we can scale up mental health services. We can ensure that people with mental, because it has even become more important than ever because of COVID-19. Because people are experiencing suicidal behaviors, self-harm, anxiety, depression. So we cannot stay aloof and continue to receive this 1.4% as the total health budget allocated to mental health and continue to sit and watch as less than 1% is given and 85 to 98 people require mental health services and are not getting. That is impossible, highly impossible, and we need to press home the issue that government has to step up investment in mental health. And that is what the Mental Health Authority, together with the UK aid, are trying to push. And we will support.
Now let's talk about mental health and the National Health Insurance Scheme. What is your take?
Very well. So if you look at the National Health Insurance Essential List, upon a review, you notice that some of the mental health conditions are there. But it has become necessary now that we put all the mental health conditions on the National Health Insurance Essential List. We cannot select which ones should be on the list. Even now, it could come to a situation where even COVID-19 vaccines will have to be on the essential list, especially for people with mental health conditions and other related conditions. Because if they cannot afford, then it should be on the scheme. And now we are saying that for now, though we haven't gotten all the mental health conditions should be put on the National Health Insurance.
That's quite a lot if you look at it.
That is true, but it's also very important because if you look at the situation whereby 7% of our GDP is lost because of psychological distress as compared to 4% in malaria, that is also quite huge. So if I look at your argument and I hear your take and compare to mine, I'm sure that mine will be applauded and appreciated.
Grateful for your time. That was the Executive Secretary of the Mental Health Society of Ghana. But before I let you go, we're still fighting this COVID-19 pandemic. And as Executive Secretary of the Mental Health Society, what can people do to, you know, have a clear head in these trying times?
Very well. So we have said that COVID-19 is coming up with more mental health associated conditions. There is fear. There is some anxiety. When will I get, and even the isolation bit of it, makes a complexity of the whole situation. Because if you are isolated from your family, your friends, it's like you are stigmatized. And that has its own psychological effect that you have to fight even after you have recovered. So we need to pay attention to those psychological counseling and ensure that even those who have not gotten it are given some support psychologically to be able to appreciate.
Let me come in here with the issue of anxiety or has to do with waiting for the vaccines. You know, people are beginning to, in the beginning, we had people who were fearing or fearful of getting vaccinated, and now people are looking forward to actually getting vaccinated. And a lot of people have, hey, would I get this vaccine? So when someone falls into that category of being impatient to the vaccine rollout, what can one do to, you know, ease themselves out of overthinking if they're going to get the vaccines or not?
Very well. So what it means is that the fact that you even have the vaccine or you are vaccinated does not insulate you from observing the COVID-19 protocols.
No, I mean those who haven't received the vaccine yet.
Okay, so whilst waiting for it, you still have to go through all the protocols, because assuming you are even given the vaccine, you will still have to observe the protocols. So whilst waiting for the vaccine, you still continue to maintain the protocols, ensuring that the masks are put, ensuring that you are observing social distance, reducing appearing in crowded areas, among others. Whilst you think that at a point, because even if you are injected today, if you are vaccinated today, you still have to follow the protocols, because that is not 100% insulation of you getting infected. So we need to follow.
Grateful for your time. That was Executive Secretary of the Mental Health Society of Ghana, Humphrey Coffie.